Now we'll quickly try to look at a vital aspect. Okay, that's like a condition okay, a condition in the urinary system. All right, that's it's a condition where the bladder is now overactive. The bladder is basically, working more than what is expected. So that's what we call the bladder overactivity. So detrusor overactivity is also known as what? Detrusor instability. It's a urodynamic condition. So it's characterized by involuntary contractions of the detrusor muscles. Okay. So the detrusor muscles are basically contracting too quick, So pathophysiology now. Detrusor muscles, which lines the bladder wall, normally remains relaxed. Okay. So, but in detrusor overactivity, the muscle contracts inappropriately when the bladder isn't full. So these contractions may be what? Idiopathic, that means the cause is not known, or neurogenic, okay, due to a nervous system issue. So causes and associations: idiopathic in some adults, no identifiable neurogenic issue or structural issue. Okay, and then sometimes it's neurogenic, that's like linked to an issue with the nerves. Okay, linked to an issue with the nerves. So it could be stroke, could be multiple sclerosis, could be Parkinson's disease, any spinal cord issue of diabetic neuropathy, where there's too much glucose in the body and is being deposited, in the nerves. Then bladder outlet syndrome, this is when something is basically trying to block urine from flowing out. Okay, so all of that could be issues. Aging and hormonal changes, reduced bladder compliance and estrogen deficiency in postmenopausal women. So symptoms is what? Urgency, so there's a compelling need to urinate. Frequency, urination is more than 6 times per day. Then Nocturia, you can't sleep in peace because the feeling to urinate will now wake you up. Urge incontinence is basically still the feeling to urinate and all of that. So diagnosis is urodynamic studies, bladder diary, where you're trying to track how often you urinated and all of that. Then urinalysis, basically you are trying to rule out infections. Alright, so that's what we got.